In October of 2007, I had a stroke. I'm a nurse, and that morning, I was getting ready for work. I was sitting on the sofa, and I was picking something up off the floor, and my right hand just went limp. I knew something was wrong, but not exactly sure at that moment what was up. And then looking at myself in the mirror, I knew immediately what had happened. Got to the emergency room, and it just so happens that the stroke team met us there.
As a member of the stroke team, I was called out to see a patient who was having an acute stroke, and that was Kim. Evaluated her and realized that she was indeed having a stroke, and we had to act quickly to administer treatment that we hoped would reverse the stroke. And because it's part of our practice, we offered Kim and her family the opportunity to participate in a clinical trial.
And my husband's like, what do you do? What do you do for this?
There are times when the patient can't speak for themselves. And this was one of those times. And her husband was there. And I remember vividly, he said to me, "What would you do if this was your loved one?" And I believe very strongly in clinical research. What clinical research means for most people is being involved in a clinical trial, where we might take our best available therapy, if one's available, and compare it to something we really believe would be better. And if it's better, we've just made an advance that might help treat the next generation of patients. The reason we do these trials is because we think what we're testing, the new treatment, is better than what we can do today. So I didn't hesitate. I said, I would want to consider being in the trial. I wouldn't offer a clinical trial to a person that I wouldn't offer to my mom.
As a nurse, I'm all about any kind of research or any sort of information that can further educate doctors, nurses, any sort of medical staff that's providing care. If there's a way that I could participate in something like that, I'm all for it.
Kim was having a big stroke, and the treatments that evolved out of that trial are better for big strokes than the standard of care, which was this clot-busting drug TPA. So we're right now doing over 750 trials here at the University of Cincinnati and UC Health, and really that means we hope to be able to offer every patient with any disease the possibility of entering into clinical trials.
The treatment that I got that day and trusting the doctors wanting to participate in the research study, all of those were the right decisions that day, and I'm grateful for that.